Howdy, this is our psychology and film final project over Pat Solitano from Silver Linings Playbook. Pat was previously a high school history teacher, but is recently unemployed and recently divorced after he caught his wife cheating with a fellow history teacher. This triggered a manic episode for him, and he beat up the other teacher. He was then hospitalized for 8 months for his behavior issues. He was recently released and wants his wife and old job back. Pat's father, Pat Solitano Sr., also suffers from OCD. Pat is diagnosed with bipolar 1 disorder. This is found in bipolar and related disorder category in the DSM-5. Bipolar 1 disorder is characterized by mood fluctuations between the two extremes of depressive and manic episodes. Bipolar 1 disorder specifically has longer periods of euphoria and manic episodes rather than depressive episodes. And in order to meet the criteria for this, a manic episode must last for at least 7 days.
Symptoms of bipolar 1 disorder. To be diagnosed with bipolar 1 disorder, an individual must have met the criteria for at least one manic episode, meaning they have been through a distinct period of abnormally and persistently elevated, expansive, or irritable mood, with an increase in energy or activity that lasted for a period greater than 1 week. And during this period of mood abnormality or disturbance, the individual experiences 3 or more of the following symptoms: inflated self-esteem or grandiosity, decreased need for sleep, meaning the individual could feel well rested off of just 3 hours of sleep, more talkative than usual, or the individual feels the pressure to keep talking in most situations, flight of ideas, meaning the individual is going through a subjective experience that their thoughts are racing, increased distractibility, meaning the individual is easily drawn to irrelevant external stimuli, increased engagement in goal-directed activities for either social, occupational, or sexual goals, as well as an increased involvement in activities with potentially negative consequences such as sexual indiscretions or spontaneous business investments. And finally, the mood abnormality or disturbance that has to be significant enough to impair the individual's social or occupational functioning in their daily life. And it cannot be caused by another medical condition the individual might have or the physiological effects of a substance the individual is taking, such as an additional medication or treatment. In addition to meeting the criteria for at least one manic episode, in order to be diagnosed with bipolar 1 disorder, the occurrence of the manic episode cannot be better explained by schizophrenia, delusional disorder, or any other psychotic disorder. Symptoms of bipolar 1 disorder in the movie. In the movie, Pat displayed several symptoms of bipolar 1 disorder. In the beginning, when he returned home from being hospitalized, it was clear that Pat had the intention of getting his ex-wife Nikki back. He kept saying that he was going to stay in shape and win her back. This made him engage in more goal-directed activities such as reading Nikki's English class syllabus, along with the books on the syllabus, while continuing to run and work out in order to stay in shape. Pat engaged in these activities so he could prove to Nikki that he was better. It was also very clear in the beginning of the movie that Pat had a decreased need for sleep. When he first got home, because he was so very goal-driven, he decided to stay up reading an Ernest Hemingway book for Nikki's class. When he finished the book, he was outraged at the ending and showed no disregard for his parents' need for sleep as he barged into their room to complain at 4 in the morning. Pat barely slept, but he was still very energetic and well-rested to some degree. And while Pat showed many signs of bipolar symptoms, one sign that was not portrayed in the movie was an increased involvement in activities with potentially negative consequences. Activities with potentially negative consequences refer to activities such as sexual indiscretions or spontaneous business investments. Pat did not engage in these activities because he was so focused on his goal of getting Nikki back.
Possible treatment. In the movie, Pat refuses to take his medication at first. During this time, Pat's bipolar disorder is difficult to control and he experiences very high manic states. At the end of the movie, he starts taking his medication and his disorder becomes much more controlled. Therefore, based on Pat's positive reaction to the medication, we recommend that Pat remain on his medication. Furthermore, continued weekly therapy sessions with his psychiatrist will allow him to talk through and overcome his past trauma that has had such an impact upon his bipolar disorder. As long as Pat is able to stay on the medications, his long-term outcome is good. He is able to function much more successfully with the help of the medication. Furthermore, therapy will help him accept his ex-wife's unfaithfulness and allow him to forgive her and her lover. Since this traumatic event triggered his bipolar disorder, accepting and forgiving may improve his condition. The only concern is that his medication has severe side effects. If any of these side effects occur, Pat may not be able to take the medication, and his probability of relapse back into an uncontrolled bipolar state is high. The film's portrayal of the bipolar disorder. The film's accuracy of the portrayal of Pat's bipolar disorder is highly debated. Bipolar disorders can look very different from patient to patient. However, in Pat's case, the movie accurately depicts bipolar I disorder through his extremely high and frequent manic episodes. Bipolar I is thought to have many more manic episodes than depressive ones. Furthermore, Pat's condition is able to improve once he begins taking his medication, which is common with many bipolar patients. The film is also accurate in portraying how Pat's bipolar condition came about. Bipolar disorder is typically caused by a combination of several physiological problems, such as a chemical imbalance in the brain or genetics. However, a major trauma can contribute to the disorder, which seems to be the case for Pat when he finds his wife in the shower with her lover. One possible inaccuracy is debated among critics. Some believe that the movie gave the false notion that love can conquer mental disabilities. Although people with mental disabilities are usually better when they are in love, love cannot cure them of their condition. Despite the possible inaccuracy, the movie did accurately portray a man with bipolar I disorder who was triggered by a traumatic event in his life. However, bipolar disorder varies widely from person to person. Therefore, although Pat's bipolar disorder was portrayed one way in the movie, it does not mean that it will look the same in others. Overall, the movie's portrayal attempts to promote acceptance and openness towards psychological disorders as its two main characters struggle to deal with their own disabilities. Furthermore, the movie provides an empathetic view of the causes behind mental disabilities and depicts the struggles that these disorders can cause. At the end, though, the characters not only learn to manage their psychological disorders, but also to not be defined by them.